Although clients come and are interested in an implant, it's very important that we just run through the alternatives for them so that they are able to decide, to make an informed decision. And to do that, you need to be given enough information to feel confident making that decision. First part of our role is to listen, to look, to weigh up these alternative treatments to help you make a decision. Take, for example, a single missing tooth. You might decide it doesn't show, you're not worried about it. What happens if I leave it? Well, there are some downsides to that. Often the teeth adjacent to that space will drift. The whole area becomes a little bit unstable. The opposing tooth will gradually, over years, not months, erupt into that space, so the opposing jaw becomes unstable. And of course, the other side of the mouth is doing all the work, so that's not ideal. The next option might be to have a denture. For some people, just the thought of a denture is horrifying. Even when a denture is done well, it's not ideal. We're collecting plaque around the other teeth, we're collecting food, it's making hygiene more difficult, and of course the extra work of that space is being carried by the other teeth, so that's not ideal either. The next option is bridge work. The problem with bridge work is that it involves drilling healthy teeth. And you might say, well, until 20 years ago or so, we did a lot of bridges and we had reasonable success with them. Nonetheless, a percentage of those teeth that are prepared for a bridge die as a result. And so then that becomes the next problem, or the problem is becoming bigger, so it's not ideal. And of course, bridges aren't stimulating the bone supporting the gum underneath the bridge, so that area gradually shrinks, hygiene becomes more difficult, food collection, and all those things. So that leaves us with implants. For the last 25, 30 years, we've been placing implants routinely for patients who've chosen this option. And the beauty of an implant is it's a standalone solution to the problem of a space. We're not asking other teeth to do more work. We're stabilizing the bite, we're stabilizing the bone, and this implant is supporting a crown that then shares in the workload of the mouth. You may have been told that a bridge is the best option for you, or leaving the space is fine, but if you want to be sure, just pop in and we can have a look and describe for you what the options are for you, because that helps you make the right decision.